Chicago Educare is located, as Dan said, in the lowest income census tract in the United States, next to one of the most depressing public housing complexes from which they have drawn the bulk of their students. It has been in operation for 7 years and is beginning to show very promising results, confirming the earlier studies, though the data are still premature. Somewhat before our own discovery of Educare, Warren Buffett told his children that he was going to fund charitable foundations for them and wanted them to research ways to invest those charitable monies with the same kind of analysis and discipline that he put into his stock investment decisions. His daughter, Susie, engaged the services of our journalist friend here today, Dan Peterson, to conduct that research, and he and she drew the same conclusion that we did, that very early childhood education was the most effective way to reverse the cycle of poverty. So she built an Educare school in Omaha, and her brother Peter built one in Milwaukee, and they launched, together with Irving Harris, a replication effort in other cities, including Tulsa. I've been blessed with the financial ability to fund one or more Educare schools personally, but I think that the involvement of opinion leaders is at least as important as starting a program, because we need to change conventional wisdom about public responsibility for education. In Tulsa County, there are only 104 early Head Start slots, and there are roughly 10,000 kids from birth to 3 in families below 185% of the poverty level. In many rural areas of Oklahoma, the situation is worse. So the public sector is filling at best 1% of the need at present. To get the Educare effort going in Tulsa and to raise awareness about what I had learned, I went on the hustings to solicit and educate a bit, and had the most remarkably positive experience. With only one exception, everyone I asked to help contributed our requested amount or more, and we quickly exceeded our target of $8 million by a large margin, allowing us to fund education for other infants and toddlers in Tulsa beyond the Educare school. We then secured an ideal site and built our first school on parkland in the midst of the economically depressed, ethnically diverse Kendall Whittier neighborhood next to an excellent elementary school. We had the almost messianic support of the superintendent of schools, the Head Start designee, who's with us today, and the director of the Department of Human Services, all of whom graciously committed their time and institutional resources to the project. The school opened last year and has had remarkable anecdotal and emotional success, with the objective measurement of its results in the works. But we feel a responsibility to infant-toddler education and to Educare beyond building a single school in Tulsa to help a small fraction of those who need the program. So we have adopted the following mission statement, quote, Tulsa Educare's mission is to help break the cycle of poverty through a flagship, very early childhood education program and through the transfer of best practices to other Tulsa programs. We're doing several things to further the broader effort in Tulsa and throughout the state and nation. The first supplementary effort to export best practices is using some of our excess funding to provide early Head Start slots outside of Educare to add to the limited number of federal positions. These programs need to commit to the 4 critical elements I described earlier, though we allow some slippage in the elegance of the architecture and the caseload of the family support workers. In fact, the local Head Start designee has enhanced his entire program to standards closer to Educare than to the minimum federal requirements. With some state help, we are funding 248 birth to 3 slots during the current school year, more than twice the 104 children the federal government is sponsoring in all of Tulsa County. And we plan to increase that number to 454 and 816 low-income children served in the next 2 school years. Our second supplementary effort was to include our Educare building, in our Educare building, a health care clinic to serve the children in the school and in the adjacent elementary school and even the neighborhood. The University of Oklahoma Medical School is assisting us with that effort. We are expanding the concept into 24 other low-income elementary schools. These 25 school-based clinics will then feed into 2 master clinics, which will have the capability of doing virtually everything a hospital can do, other than the expensive function of keeping patients overnight. Clearly, healthcare is a significant component of any effort to assure that children are provided equal opportunity in education and in life. Third, we have launched a new institute in Tulsa, designed by the University of Oklahoma and Tulsa Community College, which offers associate, baccalaureate, and master's degrees in early childhood education, focusing on infants and toddlers. We provided some startup costs and endowed professorships and secured state funding for what is the only infant-toddler-focused college program in Oklahoma, and one of perhaps 2 or 3 in the United States. We also provided scholarships, loans, and job guarantees to draw attractive candidates to the program. Early childhood education has had a difficult time attracting sufficient numbers of well-trained teachers because of the poorer pay level, perceived lesser status, and less adequate facilities than public school. These degree programs and the facilities we are building or enhancing should remedy that problem. Fourth, we have engaged 2 talented lobbyists to represent us in the state legislature to promote stronger public support for early childhood education and other anti-poverty efforts. In the last year's session, we secured $15 million, $5 million in public funds matched by $10 million in private funds for enhanced quality infant-toddler education with a nearly unanimous bipartisan vote. Governor Brad Henry, for whom early childhood education is a key initiative, has proposed tripling of the state portion of that effort for the upcoming fiscal year. He has also proposed that Oklahoma become the first state in the country to offer free education to all 3-year-olds, though our fiscal situation will likely restrict that effort to a focus on low-income kids for a number of years. Oklahoma is also already the national leader in offering universal free 4-year-old education. Fifth, we are making plans for a second site in Tulsa, which may experiment with an exclusively infant-toddler program with no federal early Head Start support. And in Oklahoma City, we are working with foundations and individuals who are developing a similar effort there, with an opening date scheduled for January 2009. The primary sponsor is the Inasmuch Foundation, formed by Edith Gaylord, sister of Ed Gaylord, who is the conservative publisher of Oklahoma's largest newspaper. Finally, and perhaps most critically important, we recognize that we can't expect the kind of long-lasting results revealed by the various studies if we dump our kids into inadequate public school programs. So we are working with Tulsa Public Schools to enhance their offerings, including sponsorship of an expansion of the KIPP school program in the Tulsa area, and through participation in the National Teach for America program. Sometimes we try to justify our public policy preferences under the mantle of economic development, and it may seem inappropriate on the surface to claim economic development from early childhood education. However, as Art Rolnick, who's with us today, of the Federal Reserve Board of Minneapolis, which has no private agenda in the matter, and James Heckman, a Nobel Prize winner for his studies in statistical sampling, have concluded that there is no better expenditure of public and private dollars to promote economic development than through early childhood education. They have calculated a 16 to 18% rate of return for capital expenditures directed toward preschool programs, including significant reductions in correctional costs and improved job skills. The Minneapolis Federal Reserve Board concludes in one of its recent articles, quote, "We're quite certain that investing in early childhood education is more likely to create a vibrant economy than using public funds to lure a sports team by building a new stadium or to attract an automaker by providing tax breaks." In most of our charitable undertakings, we deem the gain to the person being helped to be an adequate reward. Though one could certainly question the specific calculation, this appears to be one area in which society reaps a financial benefit by helping people realize the promise of American life. And many other hard-nosed businessmen have reached the same conclusion. Most recently, Bill Gates, whose foundation announced an effort last year called Investing in Children, which committed an initial $90 million to early childhood education using a model like EduCare in Washington State. And Warren Buffett's recent increase in funding for his children's foundations, at the same time that he made his spectacular commitment to the Gates Foundation, will spur expansion of EduCare's national replication efforts. EduCare in Tulsa and nationally is very supportive of universal 4-year-old schooling. And as I said, Oklahoma is the nationally recognized leader in that initiative. But I need to distinguish what I'm talking about today from universal 4-year-old programs and from what some opponents call nanny state government intrusion into people's private lives. First of all, EduCare is voluntary, not compulsory. Second, it focuses exclusively on low-income children, so the cost is a great deal lower, though education for infants and toddlers is considerably more expensive than education for older preschoolers. Third, it focuses on the time period when the greatest changes in cognitive development and school readiness can be generated, from birth to age 3.